All right, welcome to everybody watching this on our CIFA YouTube live stream. This is the second panel of our COVID-19 discussion series. It's called From Frontline Work to Frontline Care, the Unrecognized Labor That Keeps Us Afloat. It's part of our discussion series, COVID-19, Between Historical Inequalities and Future Challenges. I hope you'll watch our first video that we have up on our YouTube channel also from our first panel. This is part of our programming at the Center for the Advancement of the Humanities, and it aims to engage the Marquette community in reflecting about the historical inequalities that make certain populations vulnerable during the COVID-19 pandemic and about the future challenges these populations might face as a result of the pandemic. Towards this purpose, the discussion series is bringing together Marquette faculty whose research focuses on the intersections of poverty, race, gender, and issues related to discrimination, labor, and health. The COVID-19 discussion series is funded in part by a grant from Wisconsin Humanities with funds from the National Endowment for the Humanities and the American Rescue Plan Act of 2021. Any views, findings, conclusions, or recommendations expressed in this project do not necessarily represent those of the National Endowment for the Humanities. Before I introduce our prestigious panelists here, I want to make sure to give a special recognition and thank you to Jorge Montiel, who has been the major part of organizing this panel, of the ideas behind this panel, inviting the guests, and is the co-PI for the grant. And without Jorge, none of this would be possible. So virtual round of applause for Jorge. And with that, I'll move into our panelists. First panelist, who is also part of our first panel, is Philip Rocco. Dr. Rocco is an associate professor in the Department of Political Science. His research examines the political economy of policy expertise. He is working on a book project on Madison's Engineers, How Policy Science Remade Federalism, which is currently under contract with Columbia University Press. Dr. Rocco has also published a book titled American Political Development and the Trump Presidency from the University of Pennsylvania Press in 2020, and a book on Obamacare Wars, Federalism, State Politics, and the Affordable Care Act from University Press of Kansas in 2016. Welcome, Dr. Rocco. Up next is Sergio Gonzalez. Dr. Gonzalez is an assistant professor of Latinx studies in the departments of history and languages, literatures, and cultures. A historian of 20th century US immigration, labor, and religion, his research focuses on the development of Latino communities in the US Midwest. His book, Mexicans in Wisconsin, offers a concise introductory history of Mexican settlement and community formation across the state. His current project, Strangers No Longer, Latino Belonging and Faith in 20th Century Wisconsin, explores the relationship between religiosity, Latino communities, and social justice movements in 20th century Wisconsin. Welcome, Sergio. Up next is Dr. Melissa Hsu. Dr. Hsu is an award-winning educator in philosophy. Her research interests lie in ancient philosophy, contemporary philosophy, continental, feminist, social justice, business ethics, philosophy in the arts, and philosophy of education. Dr. Hsu taught young women at an all-girls high school in Milwaukee from 2012 to 2017, which solidified her desire to create a book aimed for young women. Her co-edited book, Philosophy for Girls, An Invitation to the Life of Thought, published by Oxford University Press in 2020, is a collection of essays by 20 women philosophers for their younger counterparts and fulfills a decade-long vision Dr. Hsu has had to help make philosophy a discipline more equitable in terms of gender identity and representation. Welcome, Dr. Hsu. Up next is Jill Guttormson. Dr. Guttormson is an associate professor in the College of Nursing. Her research seeks to enhance patient-centered care in the intensive care unit through improved symptom management and communication. Additionally, her work focuses on understanding critical care nursing practice. Her most recent study was a national survey of critical care nurses working during the pandemic with the goal of understanding the ICU nurse experience and the impact of the COVID-19 pandemic on nurse moral distress, burnout, anxiety, depression, and post-traumatic stress symptoms. Welcome, Dr. Gatormson. And last but not least is Dr. Brittany Pladek, who is an associate professor of English and the author of The Poetics of Palliation, Romantic Literary Therapy, 1790 to 1850, which examines how romantic literacy writing engaged with British medical ethics and beliefs about pain in the 18th and 19th centuries, and how these beliefs shape contemporary work in the health humanities. Welcome, Dr. Pladek, who's also the moderator for this evening's event, and so I will hand things over to Dr. Pladek.
Thanks, Drew. As you said, I am here to ask the questions. So before I turn to asking our panelists questions, just a brief overview of the format. We're going to have 2 rounds of questions. Each of our panelists will respond for about 6 minutes per round. The first, everyone will respond to a general question, and then I have some specific questions for the second round of questioning. But before I do that, I just want to, for both our viewers and our panelists, give a little bit of an overview to the issue that we are focused on today. Which is, again, the panel's title, Frontline Work to Frontline Care, the Unrecognized Labor That Keeps Us Afloat. So I'm going to share my screen so you can take a look at the PowerPoint that I put together. Okay. Can somebody throw a thumbs up to show that you see it? Okay, cool. So I'm going to do the slideshow, play from start. Okay, can everyone see the screen? Another thumbs up? Okay, great. So there's the title. Motivating the discussion. Okay, so to begin, as we know, during the COVID-19 pandemic, many people's work conditions shifted drastically. Some lost their jobs and faced the prospect of living through a pandemic with no income and no health insurance. By June 2020, 44 million people had applied for unemployment insurance. Job losses disproportionately affected immigrants, women, and people of color. And here you can see 2 studies done by the Pew Research Center in summer 2020. Other people kept their jobs, but confronted work environments that were suddenly much more dangerous, precarious, and exhausting. The CDC classified some workers as essential, meaning that their labor was necessary to keep the country running. These workers had to stay at work, and we owe our collective existence to their efforts. But being dubbed essential did not necessarily mean getting extra protection. For example, service sector workers comprise 20% of the US labor force. Yet a Harvard study found that 55% have no paid sick leave. Many were and are regularly pressured to work while sick. Saying no could mean missing rent or going hungry. To connect this point to our last panel, which examined how COVID is not a democratic pandemic, these service workers and other frontline workers, i.e. people in industries like healthcare, grocery, public transit, trucking and warehouse, and social services, are disproportionately women, people of color, and immigrants. Over a third have children whose needs compelled their parents to keep working and scramble to find care for kids home from school during the pandemic. According to the Center for Economic and Policy Research, more than 1/3 of frontline workers live in low-income families. The situation is especially dire for undocumented workers. 4 in 5 of them work in frontline jobs with high COVID-19 risks, with no direct access to federal relief money. Additionally, healthcare workers, praised in yard signs for being heroes, spent much of the pandemic working brutal hours to meet spiking numbers of COVID cases. They often lacked adequate PPE or personal protection equipment. Nurses, doctors, home health aides, hospital staff, and other care workers caught COVID in large numbers, and even when they didn't, they were overworked, exhausted, and often not compensated adequately for their efforts. For example, there's no federally mandated hazard pay for healthcare support, service, and direct care workers. So this was a short presentation, but I want to give time to the panelists. But to wrap up, during COVID, our lives have kept going because of essential workers and many other workers who are essential but who didn't get that classification. Yet their labor often goes unrecognized and unprotected, along with many other categories of labor that we're going to be talking about today. So why has this happened? How can we as a country do better? These questions are especially urgent given that last week, and this is the graphic you see before you, the CDC shifted its benchmarks for community transmission rates and now says it's okay to not wear a mask indoors, a move that's reverberated in mask mandates being dropped across the country, including at Marquette. And this, again, is not just a question of what we think the virus is doing. It's a question that is about labor and safety and working environment. So it's key to what we're going to be thinking about tonight. So I'm now going to turn over to our panelists. Oh, thank you. And I'm going to unshare my screen to do this. All right. I successfully unshared everybody. Okay, so this is the first, I guess, a round of questions, and here's the prompt. Feel free to respond to it in however you see fit. And Melissa, you're going to be going first. So to open our discussion, can each of you describe one sphere or a couple of spheres of unrecognized labor that was profoundly affected by COVID-19? So what are the pre-existing attitudes and policies in the US that led to this situation? You can also feel free to respond to anything from my opening PowerPoint or respond generally to the panel title. Feel free also to use the space to respond to either the CDC's or Marquette's new guidelines on community transmission and masking. And thanks. From there, Melissa, I will let you take it away.
Okay, thank you so much. Can everyone see my screen? Both B and I are trying out PowerPoints, which we don't usually use in presentations. So let's see how this goes. So I decided to take my sight line for this presentation to women at work, focusing on how the pandemic has affected working women in particular in a couple different arenas of their life. I'm doing this from a vantage point of being a faculty member in the executive MBA program and also working with the Institute for Women's Leadership at Marquette. So this presentation is kind of inspired by those sight lines. All right, so when we're thinking about, let's see here, the situation with women at work, the bottom line is it's not good, right? We can sum it up in terms of it's just not good. And by that, we can think about why this is the case. And we can tell a lot of stories about how women's work has been undervalued in the United States across all different classes, socioeconomic backgrounds, and so on. But the bottom line is it has been historically undervalued, and women's work tends to, of course, be paid less and be less prestigious and less rewarded overall. So there's a term that could be helpful in these sorts of conversations, and this term is pink collar work. So pink collar work is used to describe the kind of work that's done predominantly by women. First, it was regarding certain kinds of trades, like being an educator, being an office manager, and so on. But I also think that we have advanced in our understanding of pink collar work so that it actually bears to an attitude that we tend to have in work about who is doing the emotional and invisible labor in all jobs. And guess what? It tends to be women. There's a phrase called gold collar jobs, which I wanted to point out for people who might be interested. And those are knowledge sector jobs that usually have some kind of STEM component. But we can see that women working in those fields also tend to have a pink collar feel to them because they're sharing a bigger responsibility of the burden. And by that, what do we mean? Okay, so if we're going to go past what B pointed out as the devastating amounts of unemployment caused by the pandemic, in 2021, something different is happening. There is a high turnover. 4 in 10 women have considered leaving their company or switching jobs. Okay, I want to drill into this a little bit here about why this is so. So we're not talking about people who've been laid off or fired or displaced for those reasons. We're talking about people who in 2021 have considered leaving their company or switching jobs. Okay, so you've probably seen this and you've probably heard of things like the Great Resignation, also known as the Big Quit. And the Great Resignation has mainly affected mid-career workers and professionals, especially those in healthcare in 2021. And there's some really interesting euphemisms, I think, that are being used to describe what happens here. So one is called the Great Upgrade. This is something being used in the news right now about the record number of American workers who are, quote, voluntarily quitting their jobs. But if we're thinking about women at work, what does it mean to voluntarily quit your job? Another word that you might hear used these days is downshifting. So at the beginning of the pandemic, 1 in 4 women were downshifting their careers. Now, in 2021, 1 in 3 women have considered downshifting their careers or leaving the workforce altogether. Okay, so let's get into that for a second. Downshifting, I think, is also often a euphemism to cover over and describe something that's not necessarily an authentic choice being made by someone, especially a woman. So if we're thinking about downshifting in kind of an authentic, voluntary way, we're talking about someone in a relative position of power stepping back and saying, you know, I don't want this high stress job anymore. I want to do something else. And there can be an authentic component to that. But a lot of times, this downshifting is a result of specific systemic factors that influence a person's decision. So what might those factors be? So when we say downshifting, and when we see these articles about people wanting to downshift their careers, what might some of these factors be? Well, of course, the big one is childcare. If we look at the statistic here, 1 in 3 women between the ages of 25 and 44 who are considering downshifting or leaving the workforce altogether cited childcare demands as the primary reason. This is over 20% more than their male counterparts, actually. And so when we see these words like downshift or we see the Great Upgrade, I want us to have a red flag in terms of what these things might be signifying, because they're not always signifying some kind of authentic free will choice. It speaks to the historical, social, and current situations that a lot of people, especially women, find themselves in. Okay, so we kind of get into this in the C-level suites, you could say, or these higher power jobs. You know, high-powered women are 1.5 times more likely than men to think about downshifting or leaving the workforce due to COVID-19. And when we see things like that, we see that these decisions are not just being made at the employee level, but they're being made at the CEO and executive level as well. And of course, right, who's doing most of the caring? Surprise, it's women. And to end on this final note here, and we have some more things to say about how this especially affects women of color in the workplace, but when we're talking about invisible labor, it's helpful to think about it in 3 specific ways: the cognitive, the emotional, and the mental part. And so the cognitive part is that planning mode. That emotional part is managing relationships, and the mental part is kind of doing all of that for your employees, for their well-being, for in your household, and for your relationships. So, you know, when we think about people who are doing that work, as I said, it tends to be women. And the bottom line is women are not being compensated for really any of this work formally in the workplace, and that's a challenge. So, thank you.
Great. Thank you so much, Melissa. And like, excellent PowerPoint, like for not doing that frequently. That was beautiful. Sergio, you are up next. Do you need me to kind of reread the prompt, or are you G to G?
You're good. Did you bring me a PowerPoint? I didn't bring any materials. No, okay. All right. It's good. We're good. It's good. All right. I really appreciate Melissa's focus on this idea of euphemisms, which I teach an urban history class here at Marquette in the honors program, and we spend a lot of time working through euphemisms like the word crisis in urban space. And obviously, the biggest euphemism of the last few years has been this idea of essential workers. And so I wanted to focus my time today talking a little bit about the essential workers that are perhaps most hidden in the shadows and have been not just over the last few years, but have been historically over the last few decades in the United States. And that's, of course, undocumented workers. Today, Latinx workers, and especially undocumented immigrant Latinx workers, are concentrated in the frontline occupations of healthcare, food service, transportation, agriculture, and meat processing. All of those jobs that we have deemed to be essential, right? So according to the most recent estimates, 5.2 million undocumented immigrants work in essential industries. So let's break that down. U.S. Department of Agriculture says that immigrants comprise the overwhelming majority of the estimated 2.7 million farm workers in the U.S., and only about half of those workers have legal documentation in this country. Roughly half of the meatpacking workers in this country are immigrants. Many of those workers are undocumented. 400,000 cleaning staff, 300,000 packers, stockers, and shippers of essential goods, 100,000 home healthcare and personal care aides, and about 29,000 recipients of DACA, the Deferred Action for Childhood Arrival program, have been working on the front lines as physicians, residents, nurses, paramedics, or medical students. And as a result of their high rates of exposure in these quote unquote essential jobs, immigrant essential workers and their families have borne a high cost. They're much likely to contract and die from COVID, which then of course contributes to the disproportionate impact of the pandemic on communities of color. Now, because of their status, undocumented workers performing these critical jobs have no access to employer provided healthcare, unemployment, disability, or other safety net programs. I mean, it's like a really cascading problem of issues here. And of course, many of the people who are watching are probably pretty familiar with this. It gets worse though, just to kind of pile on even more. The first stimulus bill that was signed by the previous president not only excluded all undocumented immigrants from relief funds, but it actually denied aid to 1.2 million American citizens simply because they were married to undocumented immigrants. And of course, it would be easy to place a lot of this blame on the previous administration, but as I tell my students, immigration in this country has been a bipartisan consensus over the last few decades. And so this issue continued under the current administration. President Biden's sweeping $2 trillion social policy bill, which passed the Senate last November and stalled out in the Senate, included $700 billion in assistance for working families, including nearly $200 billion in direct payments through tax credits. Now, if Congress would have passed that plan, as many as 4.9 million mixed status families, those include undocumented parents and their US citizen children, would have been completely excluded from support. And as many as 1.6 million American citizen children in the lowest income families, that's 1 in 5 of all children living in poverty, would have missed out on President Biden's push to lift the youngest poor out of poverty. And of course, there's like a double cruelty on top of this, that undocumented workers contribute up to $79 billion in federal taxes every single year and $41 billion in state and local taxes every single year, right? So contributing to the economy through their labor and contributing to the economy through their taxes, and yet not able to reap any of the benefits. And so the pandemic has thrown a bright light on a historical paradox, that of being both essential and quote unquote illegal or undocumented. And as I tell my students, if anybody ever calls you essential, you should run in the opposite direction because something bad's coming at you. The pandemic has revealed a fundamental contradiction of US immigration policy, but it's one that has been at the heart of immigration policy for over 100 years. A critical reliance on immigrant labor, while at the same time we vilify and call for the exclusion of immigrants. This includes exclusion of undocumented, but also essential workers within the nation, as historian May Nye notes, is, quote, simultaneously a social reality and a legal impossibility, right? People who are barred from citizenship and don't have rights and yet exist in the country. They are, in May Nye's formulation, what we would call impossible subjects. People who cannot be, right? They're not citizens, and they're also a problem that cannot be solved. And the fact that this is an issue that our country has been grappling with for over 100 years. But it's a problem that our country has grown very comfortable with. The historian Natalia Molina refers to this as the enduring disposability of Latinx workers, that we have become very comfortable to call on Latinx workers across the last century to do that work that is essential for our economy, to keep food on our tables, more and more over the last few decades to do that essential care work, but do not include those people in the social fabric of our communities. And I don't know how much time I have left in this section, but I'd like to do in the next section as well, is to cover a little bit about what that means in Wisconsin's history. The fact that over the last 100 years, Mexican descent workers, as well as other Central American workers that have come to the state, have been recruited here to be migrant farm workers, to work in industrial labor, but at every single turn have found it very difficult to actually be included in the larger social fabric of our state, to be included as Wisconsinites, as Milwaukeeans, as members of our community. Thank you.
Thanks, Sergio. You have about 50 seconds left, so you were, perfectly on time.
Thank you.
So, okay. So, yes. Next, Jill, would you like me to repeat the opening question, or are you good?
No, that's all right.
Awesome.
I think this is really interesting to follow, because if I was to say nurses are unrecognized labor in the United States, I think a lot of our listeners would think that I've lost my mind, right? But we did a national survey of critical care nurses. And indeed, when the pandemic first hit, the signs were up in the yards, lunches were going to the units. These are our healthcare workers. These are our healthcare heroes. But as the pandemic went on, things shifted. And it became less apparent that there was support in the community for what would actually help the healthcare workers doing this work. So ICU nurses in the survey describe caring for critically ill COVID patients, caring for patients that were dying at an incredibly high rate, no family present, attempting to connect family through iPads and iPhones to dying family members because they couldn't come into the hospital. And then they would stop at the grocery store on the way home. And people would be yelling that they didn't want to wear masks and they didn't want to follow public health guidelines, and that their rights were being infringed upon. And they really describe the jarring nature of essentially putting their lives at risk and then not having people willing to do some of the things that would have helped slow COVID down. A person in the study described it that healthcare workers are not heroes. We are human and we are scared. They talked about how incomprehensible it was to them that someone would be unwilling to be inconvenienced by a mask to protect the health of others, to protect others from not dying. And I just want to read, I think their words are more compelling than mine. It's hard enough to care for COVID patients, to see so much death, but to have to constantly validate the existence of COVID in my community is even worse. Seeing people living their lives like nothing is happening is a slap in the face to the ones who have died. The lack of national support and a community desire to assist in slowing community spread has made caring for patients with COVID unbearable. And so there was a recognition. And then over time, it went away, and it really deepened, I think, the distress on workers, not just in the ICU, but across the healthcare environment. And I'm probably ahead of time, so I will pass mine off.
You are indeed. Well, that just means we'll have more time for the kind of more conversational part of this, which is great. So let me stop my phone timer here. Okay, so then to close out the first part of the panel, turn to Phil. And Phil, do you need me to reread anything, or
no,
okay?
I think I've got it. It's funny listening to Jill's description of sort of surprise at thinking that nurses could be forgotten. There are just so many different ways of forgetting what work is and who does it. And the way I want to talk about is the way that we forget work that isn't actually booked or logged as work. So when we think about this kind of work, informal care that's provided to people with health or functional needs by a friend or family member, this is something that I would have described in my research as a crisis before the pandemic. Nearly 1 in 5 Americans are performing this kind of work. I know students of mine are performing this kind of work. Family members of mine are performing this kind of work. And since 2015, that number has increased by a factor of 10 million. 60% of these people who provide this work are women. 60% of them are also involved in paid work, but are probably losing pay and benefits, including Social Security, from doing this. And 64% of these people have no paid help. And a growing number of these people are reporting needing care themselves because as they provide care, their health needs increase and that their finances have taken a hit as a result of caregiving. Now, we do not treat the work that these informal caregivers provide as part of our economic productivity, even though we wouldn't actually be able to function as a society if it weren't performed. that there are evaluation studies that estimate the monetary value, to say nothing of the real value that this provides to people, as being somewhere north of $500 billion annually. Meaning if they weren't doing this work, that's how much as a society we would have to pay. I think that's probably an underestimate. Now, during the pandemic, caregivers of this kind faced a double burden. On the one hand, they face a challenge of protecting their loved one that they're providing care for from COVID-19, because increased contact, especially if they were remaining in paid work, it was in person, without vaccination, or before the vaccine, placed their loved ones at higher risk. On the other hand, there's a high risk of severe disease among their patient population. And so national surveys that have been done of informal caregivers revealed that a majority of them reported experiencing increases in caregiving intensity, which had already been going up before the pandemic, but the intensity of the care that they had to provide, in part because of the pandemic and the associated health risks, not just the disease itself, but risks coming from that disease, intensified, caregiver burden intensified, and that was also not evenly distributed. Women experienced that increase in burden far more than men, which I think tracks with what was going on before the pandemic. Of course, there's also the case in which caregivers were diagnosed themselves with COVID-19, and they also, it's not as if their caregiver burdens went away. This increased care burden is associated with lower levels of mental health and well-being. Now, to think about this as a crisis that went on during the pandemic, it's important to understand what was going on before it, which was the United States was lagging behind other wealthy democracies in terms of the support we provided for informal home-based care. We're the only wealthy post-industrial democracy to not guarantee paid leave, and only a small percentage of employers offer it. There are policies that address or try to compensate caregiving, but they're really, really, really residual. There's something called the National Family Caregiver Support Program, which includes support groups and individual counseling. Does important work, but it's incredibly residual. It's underutilized, little known, underfunded. There's an unpaid leave program, FMLA, highly time-bound, also unpaid. There's something called the Dependent Care Tax Credit, but it's highly means tested. It's buried deep in the tax code, only applies to caregivers who are employed, not those who are unemployed or out of the labor force, who comprise a large section of caregivers. They're also not eligible. And those tax credits, in any case, even if you're able to qualify for them or you know that they exist, it accommodates for a small percentage of the income that you give up while you're providing care. Now, I should say also that there are a sort of patchwork of Medicaid consumer-directed personal assistance programs, but they can be very difficult to navigate as well. Now, one question would be, how did we get there before the pandemic? And I think there are two things to think about. One, as the ethnographer Sandra Levitsky has shown, there's a hegemonic belief system that prevents caregivers from actually becoming politically active and mobilizing for support because they do not believe what they're doing is work. It's their own personal responsibility. So that's part of it. The other thing, though, is, as my work has shown, the policy architecture we have to deal with this has really experienced drift. We designed Medicare and Medicaid. We didn't plan for the care needs that people would have for a very long period of time. And when you look at when Congress has tried to expand programs for unpaid caregivers, they face really three challenges. One, there's no real strong committee support structure in Congress that addresses the needs of aging and disabled people. Two, there's been over the last 30 years a bipartisan preference for austerity, which means that anytime you have a program that actually spends money, the only thing that Congress is designed to look at is the cost. There's no real cost benefit analysis of what that program would do. And partisan polarization ends up undermining support for social spending package. But I should say that the support for austerity here in these spending packages is bipartisan. So these policy failures meant that we had a huge workforce of informal caregivers that were at an extraordinary amount of risk during the pandemic, financial and health-wise. But our burden and what we were asking them to do only increased.
Yeah, thanks, Phil. Thank you, everyone. That was a fantastic overview. And I feel like there's a couple of different, I have specific questions for each of you, and we'll just kind of go in that order. But it almost seems as if the sort of overarching theme that all of you are talking about is invisibility, not as an adjective, but as a verb. So we make invisible those people for whose labor we do not want to pay and we don't want to acknowledge. And frequently we make them so invisible that, as Sergio points out, they become not people. They become impossible subjects. And I find this, I mean, troubling is, there's not a good, troubling is a euphemism. Like, this is horrific. And I feel like the version of the question I want to ask each of you in turn is, what do we do? Which is way too big to answer in, 6 minutes on a Zoom call. But if there were specific either policy things, media things, educational actions that we could take to either make people more aware of this labor that is invisible, or to create policy that would actually compensate it, recognize it, and protect it, what would those first steps look like? And you can address kind of any aspect of that question, or if there's something you didn't get to say because I was meaning to cut you off, like at 6 minutes, you're also free to kind of continue in that vein and say anything that you didn't get a chance to the first time. So yeah, let's actually just start back with Melissa. And if you guys want to kind of like jump in and talk to each other too, to make this more conversational, would everyone be cool with that as well? Okay, great.
Absolutely. That said, I am going to share this again one more time. But I have to say, and I'll share a little anecdote here. As you were talking, I was thinking about how, even in my own life, so this is kind of pre-pandemic here, in my own life, I left Marquette for 5 years to teach at an all-girls, quote, pro-family Catholic high school, during which time I had 2 children and I had 0 paid time off, 0. And it caught me completely off guard. Actually, I just assumed that I would get something, and I got nothing. And, the kind of world weariness that comes with that before the pandemic and then in the pandemic, and this idea of invisible being a verb, I think that this is really hitting the nail on the head here. And so, I just want to point out a few things. So when I'm thinking about women at work and I'm thinking about organizational behavior and leadership and so on, this middle part that says over 70% of companies say that working to support employee well-being is critical. Like, look at that. And think about who does that work in your own workplace, in school, wherever it is. Who's doing that? It tends to be overwhelmingly women, of course. Yet, fewer than 25% of companies actually recognize this as work. And so, if we're thinking about, and I'm happy to share these slides afterwards with anyone who wants them because they are kind of pretty, but if we're thinking about what to do, there's this quote that I came across the other day. What's needed is a proper women's strategy with specific policies to redress the inequality that's been triggered by COVID, or we're at real risk of heading right back to the 1970s with regard to women's economic power. In my own research, I got interested in this because I was thinking about the value of women's ideas at work and how there may be some more women kind of technically at the table, but that doesn't mean that ideas are being seen or heard. So, there are 4 maybe ideas we could think about, and I'll just toss them out there and then you can think about them yourselves, I guess. And they really are: pay for what you value, cultivate psychological safety. This is a phrase that Dr. Jenica Webster put on my radar from the College of Business. And this is compatible with a lot of philosophical ideas about what it means to be able to trust a workplace to even raise any of the issues that have come up, no matter where you are, whether you're on the front lines as a nurse, whether you are an undocumented worker, what does it mean to actually be able to trust a workplace? Think about structures of belonging and, frankly, amplify women's ideas. So I'm just going to echo and highlight a few things that Bea said here, and then going with these ideas of euphemism, some things that I have on my radar in terms of what to do. One step that organizations could take is to think about how ERGs or BRGs fit into the structure of an organization. So an ERG is an employee resource group, and this has become kind of a trend in organizations and companies to have these kind of additional add-on resource groups. Now, on one hand, they are really valuable because these are where people who don't tend to fit into the dominant culture can go and have support and have their networks and so on. But what happens is there's a an ancillary effect, or there's an adjacency to them where people kind of are in a position of performative allyship instead of actually being able to make change in an organization. So, if you really want to make this change and you value well-being, pay for it and think about the structure of ERGs or BRGs, because they are all fads right now, but how do they actually affect what's happening in terms of decision-making? And don't have it be just something, extra or voluntary that women do. In terms of psychological safety, this I think is absolutely key. You need to have everyone, but especially women and especially non-white women, and I didn't look at some of those slides in my presentation, be able to challenge authority, make their ideas known, and really have a voice in terms of how an organization goes. But of course, there's tons of gatekeeping and credibility excess being afforded to some people and credibility deficit being afforded to others that prevents this from happening. But a good question is always whose ideas are heard and valued and by whom. So I came across this idea in some of the research I was doing a few months ago, and I really like it. So if we're thinking about organizations and we're thinking about examining structures of belonging, Latanya Wilkins has this great book called Leading Below the Surface. And she says, if you want to be an effective leader of an organization, don't just go one-on-one, don't just go to your buddy, but what you need to be able to do is see how people are interacting with each other, especially those who are on the margins. So see how those people are interacting with other people at the organization, see where they fit, where they don't fit, and so on. And so that's a person to belonging relationship instead of a person to person relationship. I can think, for example, about what titles people are called, or I could think about how people are, if, for example, an organization is having meetings every week at 3:00 when kids have to be picked up from school, you might want to vary that sometimes because you might see who's not there and who's not allowed to kind of be present. And then finally, of course, amplify women's ideas, especially the ideas of women of color. Women tend to do this better than men, but still they're not perfect. And you can see that here. But by amplify, what I really mean is connect a person to her ideas. And in that way, bring value and legitimacy both to some, quote, impossible subjects and make this invisible work visible. So that's kind of it, I think, for me right now. But those are some ideas I had in terms of organizational structure.
No, absolutely. And thank you. I actually, there, my little timer was going off. Perfectly timed. Yeah, and so I mean, we'll just to kind of like continue in the order of presenters. Sergio, so that was a lot in your previous presentation, and I know that as with all of your presentations, asking what do we do about this is like asking, how do we cut down Mount Everest with a toothpick? But if we do have a couple of toothpicks and we are able to kind of organize them into maybe something bigger, what are some of the steps that we could take to make the labor of undocumented people more visible and to just give them the kinds of protections that we should be affording also like all people in this country and regularly historically do not? And this can either be at the policy level or at the kind of like media visibility level.
Yeah, so no, yeah, I appreciate that. So I want to jump off of Melissa's point of belonging, which is really central to the larger work that I do, which is really a focus on this concept of Midwestern hospitality, Midwestern nice that we're all familiar with here in Wisconsin. And I'm really interested to see what that means for the reception that Latinx immigrants and specifically Latinx workers have found here in Wisconsin. And what I have often found, I think, consistently across the last century as Mexicans first settled here in Wisconsin in the 1920s is that's ultimately Latinx people's right to belong in these spaces has been contingent on questions of utility, right? Their ability to contribute economically to these spaces, which means that when a person is no longer useful, considered economically useful, they're no longer wanted. And it really speaks to the precarity of belonging, of Latino belonging, Latinx belonging in the Midwest across this region. And I think before I get to the solutions, I want to kind of zero in on one of those places in the Midwest where that's become really apparent over the last few years, and that's in meatpacking, where half of the workforce are immigrants and many of them are undocumented. The great religious studies scholar Christine Nevin Warren over at the University of Iowa just published a great book on studying Iowa meatpacking. And she showed that precarity among Latinx workers is an integral part of life. It's just kind of in the air and how people live. Meatpacking obviously before COVID was dangerous. Low-wage workers in crowded spaces, cold spaces, noisy conditions, and you face punishment for absences. And then in April 2020, President Trump issued an executive order that forced meatpackers to basically go back to work. And then just a month after that executive order was passed, the CDC issued a report showing that meat processing workers are particularly susceptible to COVID because employers weren't providing health warnings in multiple languages. They weren't telling workers to work 6 feet apart. They weren't incentivized. They were incentivized to work when they were ill. There was no plexiglass barriers, like all of the conditions, right? And then on top of that, employers were actually incentivizing workers to come back into the workplace. So Smithfield Foods, which is one of the major meat packers in the Midwest, was offering a $500 bonus to people who didn't miss work in April. So you were actually incentivized, actually paid to come back even if you were sick. At one point in South Dakota, more than half of the state's COVID cases were linked to one meat processing plant. In Iowa, not only were 90% of all COVID cases in Black Hawk County tied to the meat processing plant, but Black Hawk County also had the most COVID cases in the entire state of Iowa, right? And so most Americans, of course, kind of tacitly accept these conditions because they want food on the table, and they're not really interested to hear what happens. And I think we saw that most explicitly in Wisconsin, and I always hate when Wisconsin makes the news for these types of things, but it did in May of 2020 when Governor Evers' safer-at-home orders came in front of the Wisconsin State Supreme Court. And during the oral arguments, Supreme Court Chief Justice of the Wisconsin State Supreme Court, Patience Rogensack, provided a pretty repellent example of how ingrained in society this otherness, this precarity is. She explained that Green Bay's surge in COVID cases from 60 to 800 in 2 weeks was due to meatpacking, she said, quote, "That's where Brown County got the flare. It wasn't just the regular folks in Brown County." And so here, the assumption, of course, is that meatpackers are not regular folks. They are not part of the larger Wisconsin body. They are something separate. They are something other. Now, to get to the solutions, what are we supposed to do about this? Well, I think immediately after she made these comments, the union representing these workers immediately stepped up. The United Food and Commercial Workers Local 1473, which represents 5,000 meatpacking employees in Wisconsin, pushed back against the justice's comments. Their statement rebutted the idea that these workers were any less regular folk or any less Wisconsinite than other residents of Brown County. And they argued that the union's, quote, "hardworking members live, work, and raise our families in Wisconsin and have been a part of the fabric of those communities for decades." And so I think the first thing we have to do is to acknowledge that people who do this work are human beings. And it sounds so simple, but for 100 years, it has not been the case. The other obvious answer at the policy level is a form of immigration reform. But that is an uphill slog, as we saw over the last years. President Biden made it one of his central planks of his administrative policy that he was going to push this forward last year and made it all the way to the Senate. And then, of course, it died. We expected this stance from Republicans, but there was, of course, a betrayal within the Democratic Party and inability to deliver on the Build Back Better reconciliation budget bill, which had in it some aspects of immigration reform. There have been organizations here in Wisconsin that have been pushing. I think most importantly, Voces de la Frontera, on whose organization I serve on the board. We've been pushing President Biden and Congress for a comprehensive form of immigration reform, at least one that recognizes the essential work that these workers are doing. And it doesn't just have to happen at the legislative level. It can happen through executive action. The president could expand temporary protected status. He could issue citizenship for millions through a presidential pardon of people's status, could end deportation, can use executive power to stop the separation of families by ending all contracts with and closing for-profit private detention centers, and ending programs that collaborate, that offer collaboration between immigration, customs enforcement, and local law enforcement, including programs like 287G. And we can do other things like protect all types of workers regardless of their their documentation status, like providing more hazard pay, workplace protections, and then enforcement for those protections, providing paid sick leave and disallowing bonuses based on a lack of absenteeism, which is one of the big problems in the meatpacking industry. And then, of course, universal programs like childcare and healthcare that will serve all workers, not just documented workers. But this is an uphill slog. The power kind of allied against undocumented workers, specifically their employers, is one that has prevented them for over 100 years from even sniffing at an opportunity to have a sense of full belonging in their cities, in their rural areas, in their states that they call home. And so, unfortunately, I can offer a lot of solutions, but I can also offer a lot of instances where those solutions have been trampled on.
Thanks, Sergio. I do love that notion that, just recognizing people as human is so simple and so simple and so hard to do. Thank you. So Jill, I will go to you next. So you were describing the really heavy burden that healthcare workers have faced during COVID, and that they're not getting what they need. So can you say a little bit more about what are the specific things that healthcare workers need in order to have the kind of support that they've lacked, especially kind of as the pandemic has gone on, and what action needs to be taken either at the kind of policy or societal level to improve their situation and to recognize their labor?
I think it's interesting that some of the words that nurses used were, I was dispensable. This is not what I signed up for. This is not what I ever intended. And I was not supported. And when I think about that, with really the immense recognition and support nurses have in their professional roles, and then think about all the other workers that we're talking about that are completely unrecognized, it feels to me such a social structural problem that don't feel unlinked to me, interestingly, as we're having this conversation, right? The lack of a good healthcare structure, the lack of good public health structure. And our public health departments have done amazing work, but they weren't ready to go. They didn't have the support in the beginning, right? And our healthcare systems were not ready. I just think it's a compelling narrative that somehow we aren't recognizing each other for the value that we bring across all of our workers. And for me, that's kind of the thread that's running through all of this. Specifically for healthcare workers, I think we run a huge risk that the level of moral distress and burnout, their level of post-traumatic stress and anxiety and depression, they're leaving the workforce. And I think we run the risk of thinking the pandemic's over and everything's going to be okay. And I think that's not just a healthcare worker problem. I think that's a United States problem, that the emotional trauma that everyone in the United States, particularly essential workers that were required to work in conditions that they should not have been, is not going to be done just because we were allowed to take our masks off in a lot of counties now, right? And not going to be done just because, knocking on wood and crossing all fingers, that the pandemic is winding down. But I worry that we're not going to have a good memory of our history, which I think also sometimes feels a little something that we typically do in the United States. We don't really remember our history, and we can't learn from it then. Real specifically, it's healthcare structure and its ongoing support for the healthcare workers. So that's very specific to the population that I study and serve. And it's being ready and willing to do the right things, because this is not going to be the last time that we're in this situation, sadly enough. I think with our global world, this is not going to be the last time that there's a pandemic, and it's not going to be 100 years from now. It's going to be sooner than that. But this is an amazing conversation to think about some of the social threads that unite some of the challenges we're all describing. So thank you for the opportunity.
Yeah, Melissa, did you want to jump in?
Yeah, just super quick here. And Jill, thank you for putting such a fine point on that. There's another element of what I've been looking into in terms of getting some data about mental health. And trends are showing that mental health, obviously, like, it's devastating women more than men, but across all social categories, across all economic categories, and so on. And it's affecting younger people way more than anticipated. And this is something, of course, we as educators want to keep an eye on, and we all know anecdotally, but the data and projections are not good. So in terms of what's going to happen to our younger would-be workers, caregivers, and so on. You know, I hope that someone somewhere among us is having a long memory to be able to take care and be with them as they get older. I mean, it's devastating. I'll drop some stuff in the chat, but the data is not good. There was a massive study done of all studies about mental health. And so it's like the meta study of studies, just showing these trends that are undeniable. And women across the board and younger almost across the board. And then especially, of course, if you're compromised, you have a disability, or if you're pregnant, which is sometimes classified as a disability, your mental health is being adversely affected too. But these, yeah.
Yeah, absolutely. And I feel like that's a perfect segue into kind of my final question to Phil. Or just one more thing about that. I think it is interesting that too, the kind of like mental health effects are also not just COVID related, that's ongoing. There have been studies done about the kind of younger generation's awareness of climate change, and how that's going to adversely affect their lives. And we're also seeing the way that climate change is adversely affecting, which is a euphemism. It is killing many people who live in places that are affected, especially by it. So like these are all which tend to be low-income countries in the global south. So so these are all things that are kind of interconnected. But to jump to my last question to Phil, so you talked about the ways that kind of informal care is especially invisible, and is a category that is difficult to compensate or even recognize. So what are some of the ways that we could recognize it, could potentially compensate? I don't even mean compensate monetarily, although maybe like that is the way to go. But what action would be needed to kind of, again, recognize that labor, and to protect it in a way?
Well, I mean, I want to say two things about that. First, I want to just back up a little bit, because I think a lot of the, something that Jill mentioned before is, are we going to be able to remember all of this? And will this leave any sort of imprint on what I'm saying right now? Will it leave any sort of imprint? I think we have to be realistic. The way things are presently, no. What I'm saying right now is not leaving an imprint on anybody, because the people there's a selection mechanism for expertise. As an expert on these matters, you gain power when you tell people who have power that they don't need to change anything, that we can just go on and we have every tool we need at our disposal to solve this pandemic. I remember that image of the Swiss cheese, right? Well, if this strategy fails, then there's this one behind it. And if this strategy fails, then there's this one behind it. Well, this is a fictional image of what our healthcare system looks like. And if you think about it, all of these different layers of the Swiss cheese, it was all whole, no cheese. Look at insurance coverage, right? 12.5% of people are uninsured, 21.3% of people are underinsured. Uninsured and underinsured people were less likely to be tested, including nurses, earlier on in the pandemic, right? Plenty of nurses out there who don't really have adequate health insurance, right? Even if they have health insurance. Uninsured and underinsured people, while we like to talk about vaccination as if the only thing that affects vaccination is the quote unquote immutable partisan divide, uninsured and underinsured people were significantly slower to become vaccinated than people who had adequate insurance and have, routine visits with their provider because of it. So there's a layer of the Swiss cheese that's just the whole. Here's another layer, OSHA. The agency that's supposed to, create a general rule around workplace safety, it never created that general rule in COVID. It was stalled in March of 2021 when the U.S. Chamber of Commerce, the National Association of Manufacturers, essentially told the OMB to hold up the rule, right? And essentially was scuttled. The only OSHA rule that really got through were the rules related to vaccination or test. But that was struck down by the Supreme Court in a shadow docket decision. Okay, there's another, layer of Swiss cheese that's just the whole. And I think when you can't count on the experts who make policy to fill in the holes, the only thing that's left is workers being able to have power to make those decisions about what counts as safe. that being said, we remain at the lowest level of unionization, in collective bargaining, covered by collective bargaining agreements, in a century, right? So, in terms of worker power, we did see better outcomes in workplaces that were unionized. There's a great study on New York State nursing homes and the significant role that nurses unions played, or unionization played, in ensuring that those nursing homes had better workplace conditions. There's a similar study of grocery store workers. You can see a study of the effect of collective bargaining agreements in schools on the endurance of mask mandates, and I could go on, right? But I think we have to realize that the solution to this problem, or to this nested set of problems, isn't a policy from on high. What we've proven is that the people who have the authority to make those policies have no desire to, because if you continue to articulate the kinds of things that we know actually would work, you're not going to get higher, you're not going to advance. And this is why, the people who do really well, who are on CNN, Ashish Jha, Lena Wen, they're the kind of people who are telling the Biden administration, by the way, when they're doing that, they're auditioning for the Biden administration, that they don't really need to change very much. Okay. So if that's true, then the only thing you might be able to expect would change the tide is if there is a rise in worker mobilizing, but for reasons that Sergio, mentioned. Like, I do not want to portray the situation as like, aha, and now the tide is turning. There have been strikes, there have been uprisings of workers who recognize this, but let's not pretend as if, this is a return to like the strike wave of the 1940s, even remotely. There is a long way to go here, and workers are divided on a lot of these issues, and I think we have to reckon with that. But I think that the answer, it would be, it is tempting always to believe that there's some, magical suite of policies that the Johns Hopkins, Global Health Security Index is going to offer us, but there isn't. That approach to public health has failed. Period.
Hear, hear. Thank you, Phil. All right, so we are now, I guess, in the final section of this discussion, and kind of the technical numbers on the clock are everyone has 2 minutes to do a sort of final wrap up. And we can either do that in sequence again, or we can do it kind of more as a conversation. Do you guys have a preference? No? Okay, well, yeah. Well, who wants to maybe go first? What's the last thing that you would say? Or maybe to kind of jump off of Phil's point, like what would collective action look like in the sphere that you were talking about? Or Sergio.
I just want to jump in on Phil's point, because this idea of the status quo is one that I think about often when we think about our immigration system. And we think that the term that's often used when we use terms like immigration reform is that the immigration system is broken in the United States. And of course, the reality is that the immigration system works just fine for a very select number of people in this country, which are the employers who recruit these workers, and then a large majority of Americans who are very comfortable with not thinking about these questions. And so, if we think about the way in which we have to reframe this conversation, I think it goes to that point. And the way I think we see this is, even though we think that there's kind of like a polarity in this country in terms of political understandings of immigration, that one party supports and another doesn't, it's often much more complicated than that. And I think Wisconsin is a perfect place to see that, right? So we see Senator Ron Johnson, who ostensibly would be opposed to immigration and often does vilify undocumented immigrants, but is one of the largest supporters for expanded guest worker programs to the state of Wisconsin. Because all people in the state, as well across the United States, understand that immigrants are essential not only for work, but also for filling up demographic holes across our country. And so in those rural parts of the state that have been experiencing a decline in demographics, and specifically in white communities, it has been Latinx communities, Latinx families, and Latinx workers that have filled those spaces. And so, I don't want to spend a whole lot of time in thinking about policy solutions, because I think those are clear and they're out there. I want us to keep becoming uncomfortable with the idea that the status quo is broken, right? That we're in some sort of crisis. And the reality is for Latinx families and Latinx workers, this has been the status quo for 100 years. The crisis has been here for a very long time. And to get to the point about, back to the beginning of our conversation that Melissa started us off with this idea of euphemisms. I mean, we need to deconstruct these euphemisms and to learn to be very uncomfortable when we use this type of language, because it just allows us to refuse to talk about the real issues at hand.
Yeah, again, here. Absolutely. Does anyone want to jump in on that? Yeah, Jill?
Yeah, I think you raise a really interesting point, which is correct and accurate. The last 2 years and even a little bit longer is as if people have discovered that we have problems in the United States, right? These are hundreds of years along problems and years of problems in healthcare and years of problems with racism and years of problems with sin. And as if somehow we've discovered this and now we're going to go fix it when we're not really wrestling with the really, really hard issues in all of those areas. For me, and Melissa has brought up the anxiety and the mental health, particularly of our younger generations. But they are a younger generation that are having conversations in different ways than at least I did when I was young. And I think those are the conversations that we need to support and foster and help, because I think that's where some of this change is actually going to come from.
I'll take that from there. That's where a lot of my interest lies as well, both as an educator, and as a parent, as an employee, and so on. But really thinking about young people and thinking about the workforce in a very specific way for what I'm thinking here, that is in our capacity as knowers. And so for me, a lot of this has to do with kind of big picture warding off, there's nothing I could do because it's all messed up, therefore, right? And like this numbness. And I think that really threatens in the background, even of young people, hosting coffee houses next week about what's going on in Ukraine and so on. They're doing these good things, but I think that threat of numbness, especially coming out of 2 years of the pandemic, is really there. And so my question is always, how can I help young people? And kind of as a reminder to myself as not so young, that you have a right to your ideas and that your ideas have value and that it's okay to make mistakes and not know it all the time. Because I think any kind of future we have, and I don't think this is a naive or uncritical view, but any kind of future we have is going to depend on that, and making sure that we don't just completely give up on trying to do something in some ways. If anyone here on this call were to completely give up, we would literally not be in our jobs because we'd be going and making a lot more money elsewhere, right? but we're kind of in it and we're staked in it, I think. But it's this idea that your ideas have value, that people on the margins, women, non-white people long marginalized from intellectual life, that they have a right to these conversations, that we all benefit from the knowledge that they bring. That for me is where a lot of my interest lies in these conversations, and just letting them know that even if so much of this is hopeless, it's still worth working at. And that has its own long history in labor movements as well.
Yeah, absolutely. Phil?
Yeah, I mean, I think there's a theme here. I mean, there's actually a few themes running in this conversation, and maybe could pick up on a few more of them. But I think one of them is the way that during the pandemic, and certainly for years before, that a lot of these important questions about exactly how to avoid some of these like outcomes that were pretty awful from an objective standpoint, like before the pandemic, a lot of those questions are obscured and can't even necessarily be asked because of the way that work, the way that occupational status, the way that immigration status is used instrumentally by people who have power power to divide us and prevent us from working together from taking collective action together. And I think that's certainly, like, that hasn't changed at all during the pandemic. But there has been something that has come to light as a new way. There are always new ways to divide us, right? Because they're always figuring out that, oh, actually, workers do end up being able to take collective action once in a while, and that's sort of frightening. So there are always new ways, and I think one of them is actually our health conditions themselves. If you think about the pandemic itself and the way that because of the way that health is treated hegemonically as an individual experience, even though health is profoundly and fundamentally collective, but the individualization of health has a profound function in dividing us, because it says to us that the way that you experience crises, big or small, is really your problem, and nobody else's. And that difference can be really easily instrumentalized by politicians or employers to divide workers, individualize risk, to create tension over what it means to return to normal by, for example, pitting our personal conveniences against somebody else's safety. Right? That very thing is an example of the way that that fiction of individual health can be used to drive a wedge between us and actually separate us. But it doesn't just separate us on those issues of, like, should you wear the mask? Should you not wear the mask? That's where we are at Marquette right now, obviously. But it also has a way of turning our attention away from the policy changes that, were we to enact them, would actually make us all better off, regardless of whether or not we have comorbidities or we're immunocompromised or whatever, right? It turns us away from thinking about paid sick leave. It turns us away from thinking about the fact that our, premiums and cost sharing go up every year, and that's true in the national employer benefits surveys that Kaiser Family Foundation does. Like, we know that, right? But as long as we're focused on, my health is really based on my choices, and that by making myself well and imbibing wellness, right, as this individualized kind of fiction, I'm going to make myself well, and the people to blame for my higher costs or worse health conditions are those other irresponsible people. Well, you see, we all lose, I think, when that's the case.
Absolutely. Just was writing down in my notes, decision fatigue as a weapon of necropolitic capitalism, potentially. Yeah, I think we're a couple of minutes before, like, the time we're supposed to turn to YouTube questions. But I feel like that was a kind of good concluding moment. So can we turn to the folks who are attending on the live stream? And Jorge, you're going to ask some questions, and then I don't think I need to specifically direct them to people. I trust all of our panelists to jump in when they feel like they have a response to a question. But would you be able to read some of the questions in the live chat?
Sure. We have a couple of comments. Valerie Lynch says, my mom is a high school teacher with students with immigrant parents who work in meatpacking. At one point, her students' parents got COVID, and they had to miss class to work to support their families. This is, I think, responding to what Dr. Gonzalez was talking about. Amber Wichowski says, exclusion of immigrants from the social safety net has a long history. And we have a couple of questions one from Dr. Kim, and I can also formulate a question myself, but if you broadly want to respond to this, perhaps Dr. Gonzalez or somebody else.
Yeah, so I mean, I appreciate that comment, and the individual sharing that experience from their own life here. The point that I would make here is that we often think of this term of mixed status family when we think about documentation status, but the reality, of course, is that mixed status family can also apply within Latinx and undocumented families when you think about the downstream effects. So these children, of course, are not going to work in meatpacking. It's not the case of the migrant farm workers in Wisconsin in the 1950s and 60s who were actually out in the fields with their parents and who were being affected by pesticides and who were working, 14-hour days. But here, of course, the consequences of their parents being forced to work in these unsafe conditions where they're going to contract COVID and then bring it home to the rest of their family is pretty clear, right? And so to Phil's point about the ability of some people to individualize and then the inability of others to even have that option, right? And we see this in the kind of the explosion of the pandemic within communities of color, where often people are tightly packed within spaces and their social networks are kind of tied among other people who are working in similar conditions, right? And so when we think about this concept of mixed status, often it means more than just a person's documentation status in this country.
Dr. Kim's question goes along with I think Dr. Rocco was talking about. He says, "Who does the narrative of personal responsibility privilege?" And I think the second part of the question goes more to Dr. Guttormson. He says, "And does emphasizing the resilience of healthcare heroes serve as a pretext for violating the rights of this population?" So perhaps we can start with Dr. Rocco and then move on to Dr. Guttormson.
No, I mean, I think you could think about that narrative of personal responsibility is it privileges people who, on the one hand, I think it further commodifies or reinforces the legitimacy of like the commodification of health, the treatment of health as something that one purchases, right? And so if you're, rich, you can purchase, essentially whatever, as much health as you need, right? That's sort of on the one hand what it does, but also that individualization of risk narrative, I think, privileges employers and governments, as well as the gatekeepers of health in the United States, certainly insurance companies, in the sense that it allows them to offload risk, certainly risk in monetary terms, onto the individual, right? And I think that wellness programs within workplaces are a great example of this, which is that there's very little clinical research to suggest that the wellness programs work for any number of conditions, but that hasn't stopped employers from using them because it allows them to do more cost shifting onto their employees. I mean, it's very, very easy to understand, and you can scale that up to any number of institutions that have that sort of gatekeeping function. But I really want to hear Jill talk about the heroes question. It's really important.
Yeah. So I also want to just say that individual actions have very little to do with overall health, right? I know we all know that, but I don't think we can say that enough, that there are being able to go to a doctor, being able to go to a gym, the individual action has way more to do with social determinants of health and many things that are completely out of the control of individuals. So I know we all know that, but I think it bears stating one more time. And if I'm understanding the question, Jorge, can you repeat the last part of the question for me?
I think you're muted.
Yeah, so does emphasizing the resilience of healthcare heroes serve as a pretext for violating the rights of that population?
So I think what it did, the healthcare heroes, it allowed people to put signs in the yards, and it allowed people to say, well, we're giving them food and we're bringing things. And it didn't actually address the problem, right? Which was lack of PPE, lack of personal protective equipment, lack of enough beds, lack of enough ventilators, lack of enough sleep because they were working double shifts. So it put a Band-Aid on a huge gaping hole and wound. And so it put the burden of actually doing the work on individuals to make it work without the resources to be able to do it well. And I think people had really good intentions about talking about healthcare workers as heroes, but it didn't have any substance connected to it. And in fact, some of the nurses talked about, and this of course isn't true of all hospital administrations, but they talked about feeling like they were being just forgotten and just not supported in a way, just, well, you just have to make it work. This is just what has to happen. And so I think it was well-intentioned. I think that it didn't actually put the right narrative out there about how one truly supports the workers that are caring for the community. And so in the end, I don't know that it did harm, but it certainly did not help. Yeah.
Could I jump in there really quickly just about the kind of rhetoric of like this is actually a little bit my lane as the literature scholar who heretofore has had very little to say, but I think the rhetoric of heroism is a really interesting one for the USA specifically, and particularly in a moment where our favorite movies are all 2-hour-long epics about like superheroes who can get so much shit thrown at them over and over and over again and keep getting back up. And I think that the kind of hero myth is one that the US has cultivated alongside the bootstrapping myth, which sets people up who are heroes as those who we do not need to help. They are the kind of foundational myth of the person who helps themselves and can take all of the damage and then keep going. And so by calling healthcare workers heroes, I think, Jill, you're totally right. Like it's a well-intentioned gesture, but what it's actually saying is we expect you to be able to do this on your own, and we fault you for asking for help because none of the good Marvel heroes ever really ask for help. They just get back up and then win the fight. I think that kind of our obsession with heroism is also interesting when we consider the kinds of collective action which do lead to real change. If we have the kind of myth of the singular hero who gets stuff done, then people aren't going to be seeing their ideal as people banding together to kind of fight for their rights. And there's a weird way in which the kind of hero figure is simultaneously, this icon in American society, but also entirely empty because like the hero is presumed not to exist in society, to exist above or outside of society. It's weirdly the kind of like rhetorical inverse of the invisible subject because the hero is hyper visible but also extremely empty at the same time. And the invisible subject, the impossible subject, is simply not seen. But they're both never afforded help or kind of recognition, or one is afforded hyper recognition and the other is afforded none, but both are expected to help themselves. They wear the same bootstraps.
And this is why women are leaving the workforce in droves. They're exhausted, right? They're applauded in many ways for doing it all, caring for the home, caring for other people at work, but they are literally not being compensated for it. They're not being recognized for it. And so it never amounts to even like a whiff of a narrative of any kind of heroism in any sort of way. You just do it and then fall down at the end of the day, and I think that that's why we need to be careful of these different tropes going on and how we're addressing the pandemic and how we're talking about it and the ways that we're using this language of look at her go, or like that person's a hero, when, for a while we were talking about maybe calling those front care workers victims instead of heroes. That nurse is a victim of the pandemic. I mean, that's something to at least consider in a way. Or the person working at that grocery store is a victim, victim, hero, and so on. But this idea of the invisibility of one's position not ever being fully recognized, let alone compensated or belonging, I think that's another theme running through all of these comments.
Yeah, there was a really interesting dichotomy from the open-ended responses where the word hero really over time started to just not resonate. Yet nurses would talk about but it is actually good to finally be recognized for what we do for society. So it was this very odd kind of two sides of a coin that, depending on how they were doing that day, was either rewarding and uplifting or demoralizing, depending on really like what else was going on and how their day was going and how their mental health was that day. So it was very compelling to read the transcripts and the comments.
Are there any more questions in the live chat?
Question. Oh, sorry. No, but I can formulate a question, if you allow me to. So one of the things that motivated this discussion series is, or one of the questions that motivated this discussion series, and now that we're talking about tropes, one of the things that I was very interested was about how sort of we, in the case of immigrants, for example, people of color, the way in which we relate to people is in terms of tropes such as criminalization, right? So we see immigrants, or at least the way in which we have sort of rhetorically and in terms of the media, the way in which we portray these people, and also African American men, et cetera, is in terms of as criminals. But I started wondering if perhaps the trope of health and hygiene may be also contributing to the way in which we are racializing people of color generally, but also immigrants. At the last panel, we talked about the way in which, for example, the Biden administration is deporting immigrants, and how this is exacerbating the way in which immigrants are dealing with COVID-19. And so this may loop into not only are we sort of excluding them, but also perhaps we're creating a new trope in which we are relating to immigrants and people of color more generally. So just feel free to jump onto this comment.
Yeah, I mean, so as a historian, it's my job to plant the flag and say that none of this is new, unfortunately. And so, here I refer to, again, I think I mentioned her earlier, but the historian Natalia Molina, who has done fantastic research detailing the medicalization of immigration narratives, and specifically kind of the creation of this idea of the dirty Mexican and kind of its reverberations across the 20th century, right? And so it has so many obvious effects, right? In the 1920s, when Congress was passing laws to limit immigration from Southern and Eastern Europe, and they left the door open to Mexico. One of the reasons they did so is because agriculturalists demanded a continued source of labor for their cheap and backbreaking labor. And here Mexicans were portrayed as being naturally capable of doing stoop labor, of standing under the sun, and of doing this work on hours on end. And not only that, they were also often called birds of passage, that they would be like geese that would come up to work in the United States, and then when their jobs were done, they would just migrate naturally back to Mexico, right? And so we see that kind of across the 20th century in different ways in which Latinx workers and undocumented workers and workers with kind of tenuous hold on documentation status in this country have not only been kind of buffeted into those positions, but the justification for that type of treatment have often fallen within kind of this idea that they're naturally susceptible to and naturally capable of doing this work because of some sort of, racialized understanding of their capacity.
Last, we have a comment from Amber Wichowski, who says, yes, hero is the rhetorical inverse of the invisible worker. Neither afforded help or recognition. Thank you, B.
I should hasten to say that I don't want to kind of like equate their material conditions because they're really, really different. Just want to put that out there.
No, but it's funny because, not that their material conditions are equated, but I've sort of wondered, what is the version of the economy, or for that matter, the public health quote unquote system that if you were to make a diorama of it, right? What would that fictional version look like, right? You'd have the lone heroic worker, but there would be tons of workers that simply aren't depicted whatsoever. And then there would be these, in a sense, kind of magical ways in which public health is protected. I mean, it's sort of interesting to me how the wide tolerance for infantilization that we have surrounding, the way in which we're told that the economy exists and the public health system exists. It's sort of fascinating to me.
We have one more comment from Dr. Alexander Martins from the Theology and Nursing Department in San Marquette. He says, I never totally got why people refer to certain individuals as heroes in the US. Sometimes this excuses leaders from doing social actions that can impact on people's lives.
I mean, I can jump in with that. Like, I think one reason that hero is a category that we're especially attached to is because there is a literary term in Latin which translates in English to the translation of empires, and empires over the world have consistently justified themselves by saying we're like the new version of this old empire. So Britain in the 19th century, while it was colonizing the world, liked to see itself as the new version of Rome. America likes to see itself as the new version of, I mean, we pretend not to do this because rhetorically we like to distance ourselves from Britain, but we do see ourselves as the kind of still ascended world empire and get very butthurt anytime anybody challenges our status. Like, and yeah, we should start closing the conversation now. But heroism goes along with the discourse of empire. Those two things are linked. And I think that one reason we prize heroes as cultural figures is because we see ourselves still as the empire who is always going to be on the right side of history. And so many other terrible things flow from that. That's oversimplified, but we need to close off because it's 6:31. So I will say thank you so much to all of our amazing panelists. That was a fantastic discussion. I feel like I learned so much just from sitting here listening to you. Really, really fabulous. Please give yourselves a round of applause because we don't have a physical audience here, but thank you all so much. And Jorge, thank you so much for putting this series together. Really fantastic work.
Thank you so much. Tune up and check us out on the Center for the Advancement of the Humanities. On YouTube, you can find the other COVID-19 panels. So check us out there. Like us on Twitter, Facebook. And thank you so much, everyone. It was a fantastic conversation.
Thank you, Jorge and all.
Thank you, everyone. Have
Thank
a
you.
wonderful evening.
Great panel.
Thanks, everybody.